Hello, everyone. Today, we're going to explore a very important area in public health called analytic epidemiology. This field helps us understand the deeper reasons behind diseases. It asks why and how diseases occur in populations. It's different from descriptive epidemiology, which focuses on who, what, where, and when a disease happens. Analytic epidemiology goes further. It looks for causes. It searches for risk factors. It also tries to find protective factors. This means it wants to know what increases your chances of getting sick and what decreases them. Scientists use specific methods for this. One common approach involves observational studies. These studies watch groups of people without directly interfering. Two main types are very important here. First, there are cohort studies. In a cohort study, researchers follow a group of people over a long period. They might track their habits, environments, or exposures. Then, they see who develops a disease and who doesn't. They compare the rates of disease between those with a certain exposure and those without it. For example, they might follow smokers and non-smokers to see who gets lung cancer. Second, we have case control studies. These studies work backward. Researchers identify people who already have a disease, the cases, and compare them to people who don't have the disease but are similar in other ways, the controls. They then look into the past to see if there were differences in exposures or risk factors between the two groups. For instance, they might ask people with food poisoning and a similar group of healthy people what they ate recently. Sometimes, analytic epidemiology also involves experimental studies, like randomized controlled trials. These are often used to test new treatments or preventive measures. Participants are randomly assigned to different groups. One group might receive an intervention, like a new vaccine, while another group receives a placebo or standard care. This helps to establish a clear cause and effect relationship. However, for studying the causes of chronic diseases in the general population, observational studies are more common due to ethical or practical reasons. The goal of all these methods is to identify associations. It is to find out if one factor truly leads to another. This knowledge is crucial. It helps us understand how diseases spread. It shows us what behaviors or environmental factors are dangerous. It also highlights what interventions might work best. This information then guides public health policies. It helps doctors advise their patients. It informs campaigns to prevent illness. It ultimately saves lives and improves community health by pinpointing actionable steps. Thank you for watching and learning about analytic epidemiology with me today. If you found this information helpful, please consider supporting the channel by liking this video and subscribing for more content like this. Your support helps us create more educational videos.